Hi, my name is Sarah Quate and I'm here today to talk about my industry placement experience for Advanced Clinical Exercise Science. This term, I completed my 40-hour placement with a local business called Be Me Movement with a Purpose. Be Me is a family-owned business that provides exercise physiology and personal training services to the White Bay area. They were established in 2006 and are located in Hervey Bay. However, they also service the areas of Bundaberg, Maryborough and Agnes Waters. Be Me is a business that is team-orientated, with their major focus being on patient care as they aim to improve the quality of life and health of clients through correct exercise choices. They aspire to provide a range of services that can be utilised by a variety of populations ranging from young children to older adults. Be Me services consist of individual and group training sessions, hydrotherapy, water aerobics, Pilates and lifestyle modification programs. Be Me Movement with a Purpose is made up of an amazing team of staff that comprises of 3 exercise physiologists and a personal trainer. Throughout my placement, I had the opportunity to work with a variety of different populations. One chronic disease that I had the most experience with was type 2 diabetes. The majority of clients were newly diagnosed and had limited knowledge of the effects of physical activity on blood glucose control. Clients are both males and females aged between 35 and 79 years of age, with the majority being overweight or obese. Other major risk symptoms observed throughout the placement was blood glucose levels greater than 6.5, as well as high blood pressure and cholesterol. Another common chronic disease that I observed was hypertension. At-risk symptoms that clients presented with were a systolic blood pressure greater than 140 millimeters of mercury and a diastolic blood pressure greater than 90 millimeters of mercury, with lifestyle factors such as excessive smoking and a sedentary lifestyle being major risk factors. Throughout my time at Be Me Movement with a Purpose, I had the opportunity to supervise and monitor client performance, take clients through pre-exercise medical questionnaires, as well as measure and record clients' fitness levels and anthropometric measurements. Furthermore, I observed the prescription of exercise to chronic conditions, instructed a range of group fitness classes, and took clients through individual sessions in the gym and in the pool. What I experienced throughout my placement exceeded any expectations I had, as I did not anticipate to be given so much hands-on experience, and this is why I believe I enjoy my placement as much as I did. During my placement, I used my organisational skills and hard-working attitude to contribute to Be Me by developing and implementing a group diabetes circuit class. Be Me provided me with the opportunity to implement this class each week, and I believe it was beneficial to Be Me as the class was aimed to provide benefits to chronic populations. Throughout my time at Be Me, my supervisor also allowed me to coordinate and instruct group classes such as a pregnant ladies Pilates class and a group hydrotherapy class. Each week, my confidence and industry knowledge grew, and I believe that I effectively implemented information from course lectures to provide clients with effective exercises and feedback. Through the completion of my placement, I personally saw an improvement in my skill set. I developed the ability to confidently prescribe individualized exercises to clients with a range of varying conditions. This was achieved by observing referral consultations and follow-up appointments. I believe that by listening to my supervisor during the consultation process allowed me to pick up on exercises that are beneficial for different individuals. I observed the prescription of exercise to people with a wide range of conditions such as cancer, diabetes, morbid obesity, mental illnesses, amputation, and osteoporosis. I believe that the large variation in clientele is the reason why I learnt so much valuable information about exercise prescription. I also believe it is what helped me to develop my ability to work collaboratively as part of a healthcare team. I improved my capability to critically analyse client information and provide specific and constructive feedback. This experience has also provided me with the skills and knowledge needed to interact with a variety of people, including clients with Down syndrome, autism, cystic fibrosis, as well as mental illnesses. This experience was valuable as I developed greater confidence to complete tasks independently, as well as the ability to talk and interact with clients and other health professionals. BME has opened up another opportunity for me in an industry that I never thought I would enjoy, with the option now available to complete further study in exercise physiology. I believe I have developed effective communication and organisational skills, as well as a strong foundation of knowledge needed to work professionally with patients and staff in a variety of clinical settings, with these skills essential for my future career. This term, my written project was about exercise prescription in the treatment of type 2 diabetes. My reason for interest in this population is due to the frequent exposure to the prescription of exercise for clients that were newly diagnosed with type 2 diabetes. Through completing this report, I found that the prevalence of diabetes, in particular type 2 in Australia, is increasing and becoming one of the country's greatest public health challenges, with the chronic disease one of the leading causes of morbidity and mortality for 90 to 95% of all diabetic cases worldwide. The increased incidence can only be attributed to the increasing prevalence of physical inactivity and obesity, with current research supporting the beneficial role of physical activity in the prevention and management of type 2 diabetes. Lifestyle factors and genetics are the primary causes of type 2 diabetes, with physical inactivity, cigarette smoking, excessive alcohol consumption, increasing age, and obesity major risk factors. Inactive diabetics have an increased risk of cardiovascular disease and a lower functional capacity, as dysfunction of vital structures such as the heart and peripheral blood vessels is likely. Inactivity of patients can be critical, as it not only induces feelings of depression but disrupts glucose homeostasis, as low levels of physical activity can lead to elevated levels of blood glucose. Furthermore, patients who lead a sedentary lifestyle are at an increased risk of developing abdominal obesity, with research suggesting that free fatty acids released from adipose tissue increase insulin resistance. The effects of exercise on diabetes is well known, with physical activity establishing good glycemic control, as regular exercise has been shown to reduce blood glucose levels both during and after physical activity, with aerobic and resistance training the most suitable treatment of type 2 diabetes, as it has a beneficial effect on cardiovascular risk factors. Therefore, it is important that type 2 diabetic patients maintain regular physical activity to ensure the control of blood glucose and to decrease the risk of cardiovascular complications such as abdominal obesity. The placement was conducted in an exercise physiology clinic that specialises in the development of lifestyle modification programs for medically referred clients. Frequent exposure to the physiological effects of exercise and nutrition on type 2 diabetic clients was gained and is the reason for interest in this population. Throughout my placement, I observed and conducted blood glucose monitoring and the prescription of exercise type, frequency, intensity, and duration, with individual and group exercise services such as water therapy, gym programs, walking routines, and home exercise programs offered to ensure the clients develop positive, lifelong physical activity behaviours. A search of relevant literature was conducted by using CQ University Library's Discover It database. The search aimed to identify literature based on the relationships between physical activity and type 2 diabetes. Health screening and risk assessment tools were used effectively throughout the placement to gather information regarding a client's personal health, lifestyle, and exercise readiness. All clients assessed throughout the placement were medically referred, in which a thorough medical history was provided by the client's general practitioner. A brief health and exercise questionnaire was also filled out prior to the consultation to provide information on clients' lifestyle and exercise readiness. Furthermore, an extensive list of questions regarding cardiovascular disease symptoms and exercise restrictions was completed verbally throughout the consultation, with all information gathered used to stratify risks. After the completion of the health screening, physiological assessments were immediately completed, with the most common test being the 6-minute walk test. This is an inexpensive, sub-maximal assessment of a client's exercise and functional capacity, with the information used to develop effective exercise sessions. Another commonly used test was the 30-second sit-to-stand assessment, which is completed to assess leg strength and physical endurance. While a 1-minute bicep curl test was also used to provide valuable information on a client's upper body strength. Blood pressure, blood sugar, and blood cholesterol were also recorded, with all tests reassessed every 3 months. Exercise prescription to clients with type 2 diabetes focused strongly on weight loss maintenance and improved glucose disposal through aerobic and resistance training. Different methods of exercise, such as water aerobics, circuit classes, and walking programs, were used to develop cardiovascular fitness and upper body strength. The exercise recommendations from American College of Sports Medicine were also used in the development of diabetes lifestyle modification programs. Special consideration was taken when prescribing exercise to clients who take insulin, as hypoglycemia is the most common problem associated with exercise. It was important to ensure that clients were monitored, as physical activity can cause rapid drops in blood glucose. Furthermore, the timing of group exercise programs was also considered, as individuals who take insulin are not recommended to participate in exercise during peak insulin action. Frequent feedback was provided to clients, as research has suggested that inadequate support is one of the reasons why adherence to an exercise program does not occur. The clear delivery of instruction and feedback on technique was also important, as many clients transferred exercises learnt in group classes to the home environment. Goal setting was an effective measure used to motivate clients and improve self-advocacy, with the reassessment of goals and functional tests completed every 3 months. It has been well documented that a combination of aerobic and resistance exercises are beneficial for glycemic control and weight loss in type 2 diabetes. Improvements in hemoglobin levels, blood pressure, body composition, and blood flow was reported in multiple studies, with a significant incremental improvement in glycemic control recorded. Key exercise prescription guidelines support the combination of resistance and aerobic training exercises in the management and prevention of type 2 diabetes, as it facilitates reductions in both visceral and subcutaneous fat, as well as improvements in metabolic and lipid profiles. Exercise prescription during the placement followed current recommendations, with improvement in body composition and functional capacity recorded. With this being said, resistance training was only encouraged in type 2 diabetic clients without certain risk factors, as resistance training can have adverse effects on conditions such as uncontrolled hypertension. Exercise prescription throughout the placement was individualized and tailored to clients' exercise capacity and preferences, with group classes aiming to utilize a range of beneficial training techniques. A common method used during group classes was high-intensity interval training, as literature suggests that it can rapidly reduce hypoglycemia, as well as increase the oxidative capacity of skeletal muscle in clients with type 2 diabetes. This training method allowed clients to work at the recommended intensity of 50 to 80% of their heart rate reserve, which increases maximal oxygen uptake and reduces subcutaneous and abdominal fat. During this placement, observation of group diabetes classes established the importance of varying exercise type, as literature suggests that exercise variation is important for establishing long-term exercise adaptation and motivation. For this reason, many classes used a circuit-based approach so that multiple training methods were utilized. In conclusion, physical activity plays a significant role in the management and prevention of type 2 diabetes. A combined resistance and aerobic training program provides greater improvements in blood glucose levels and body composition, as regular exercise reduces cardiovascular disease complications. An emphasis on exercise supervision is required to ensure client motivation and compliance, as it is necessary to develop self-management skills. This report may be useful for exercise prescription to newly diagnosed type 2 diabetic patients, as combined aerobic and resistance training should be encouraged by all health professionals. Furthermore, this information can also be used as a teaching tool in educational settings for understanding the effects of physical activity on blood glucose levels. Thank you for taking the time to view my presentation, and I hope you gained an insight into my practical experience at Be Me Movement with a Purpose.